AI chatbots are becoming a bigger part of our everyday lives, and while they have the potential to expand access to mental health care, experts with the University of Washington School of Medicine are telling the public to be wary of mental health chatbots.
And that is because they're still largely unregulated. And joining us to continue the conversation is Dr. Thomas F. Heston, who is a clinical instructor of family medicine. Doctor, good morning to you from Spokane this morning.
Good morning.
Nice to have you with us.
Thanks for having me.
Nice to have you with us. So you recently published a study about the use of AI chatbots and mental health. What were some of your big takeaways from that study?
The big takeaways from the study were that this potentially is a very useful tool. However, it's still unknown, unregulated, and there are some dangers with using it alone without a human counselor or psychologist if you really have severe mental health problems.
Doctor, you expressed concern about programs called generative pre-trained transformers like ChatGPT. Why are you concerned about these programs when it comes to people seeking care?
Well, there's a lack of human connection there, and these are programs which are not human, but they're very tricky. They really make you think you're speaking with a human. And when we have mental health problems, like it's been raining 3 weeks in a row and we're just a little depressed, we're a little bit more vulnerable to being influenced, possibly in the wrong way, by a machine.
We know that for a lot of us, and I would say doctor myself included, that AI technology is still fairly new. Do you think there will eventually be a point where that type of technology will actually be beneficial to those who are seeking care, particularly mental health care?
Yes, I really do. I think this is a mixed bag. There's a lot of good in it, but we just need to do a better job at the severe cases where there might be a crisis situation. The machine, what we found is the machines weren't very good at recognizing crises. The real severe situation where somebody would need to go to a hospital, need to get checked in, need immediate help. And in those situations, the machine wouldn't reach out to a human, wouldn't tell you to go to seek further care, nothing like that. So it had some pretty severe blind spots. But on the other hand, it is available 24/7. It can reach to all parts of our rural areas and people who can't get out of home. So there's a lot of really good potential here. We just need to make sure it's a tool and not a crutch.
A tool, but not a crutch. I like that. It definitely sounds like there's still some more work to do when it comes to Chat GPT and these other types of AI platforms. For anyone who is seeking mental health care but may not be able to afford a specialty doctor like a therapist, what do you recommend they do? Where should they go?
Well, the primary care providers provide a lot of that. And you always go to a human, a friend, someone you can trust, try to get into a specialist. But there are a lot of people out there that care about you and that have your best interests at heart. And always reach out to somebody directly. That's the best advice that I have, is work with people that really care about you, and there are a lot. We all have a lot of people that care about us.
Yeah, we sure do. And it's fascinating to see how sort of AI technology is changing the game a bit when it comes to healthcare. So appreciate you joining us to talk about the study and your thoughts on the technology's impact on healthcare as we move forward. As we see, it's changing quite a bit. So nice to chat with you this morning.
Yeah, thank you very much. Let's make sure it turns out well for all of us. And I think it will.
Thank you. I think so too.